Hello everyone. Now we are going to discuss about Flea indices and blocked Flea, which is important for very short as well as for why we're concerned. And I'm Dr. Anusha, Assistant Professor in the Department of Community Medicine. First, we will see brief introduction about fleas. So, fleas are small, bilaterally compressed insects, and they will suck blood from mammals and birds. There are different types of fleas of different species like rat fleas, sand fleas. So in rat fleas also Xenopsella chiopis is there, Xenopsella astica, and sand flea is Tunga penetrans. So like that many different types of fleas are there. Now we will see what is flea indices. So these flea indices are an epidemiological measures used in flea surveys to assess flea abundance. That means fleas number are more or less, and it will tell about vector risk. That means because of vectors, how many diseases are spreading. So this is vector risk and environmental contamination in relation to rodents. So if environmental contamination is there, rodents will be there, and on rodents, rodent fleas, rat fleas will be there. And now we will see different indexes which we will use uh, flea indices. So first one is total or general flea index. So this is nothing but the average number of fleas of all species per rodent. That means it count all the species of fleas. So all the species of fleas per rodent, how many are there? And it will be calculated with the formula of total fleas of all species by total rodents examined. So it will give per rodent how many fleas are there of all species. And what it will signify means it will measure the overall flea abundance and sanitation level. So if general flea index is more, then it will tell that flea abundance is there. That means fleas are more in number, and it will tell sanitation level is not good. If sanitation level is good, then this flea index will be less. So as second one is specific flea index. As we discussed, there are different species of fleas. Here we can calculate specific flea index for all the species, and the most important species in this fleas is Xenopsella chiopis, which will transmit plague disease. So specific flea index is average number of fleas of each species found per rodent. So we should know per rodent how many fleas of each species are there, we should know. If this Xenopsella chiopis species are more, then we can tell that there is a risk of outbreak of plague in rodents, and that will be transmitted to humans also slowly. So it will be calculated like fleas of specific species by total rodents examined. And what it will signify means it will focus on uh, primarily on vectors. So the most important vector, as I said, is Xenopsella chiopis. And third one is specific percentage of fleas. Specific percentage of fleas is percentage of fleas of each species found per rodent. That means to know which species is more in percentage. To know that it will be useful, and formula is fleas of specific species by total fleas. So which flea species is more abundant we can know into 100, and it will shows the dominance and changes in flea biodiversity. Because of changing in flea biodiversity, which species number is increasing and which species number is decreasing. So specific percentage of fleas. And fourth one is burrow index. So this rodents and rat fleas will live in rodent burrows. So to know that, use burrow index. Burrow index will be calculated free living fleas from burrows by rodent burrows sampled. So how many burrows we are inspecting, and in that how many free living fleas are there. So that will be taken, and it will assess environmental contamination independently of hosts. That means how much is the environmental contamination with fleas we can know. So till now we have seen how to calculate all the flea indices, and here we will discuss about specific flea index of Xenopsella chiopis. If this specific flea index of Xenopsella chiopis is less than one means what it will tell, more than or equal to 1 means what it will tell. So, if the specific flea index of Xenopsella cheopis index is less than 1, it will tell that low risk for epizoonotic diseases in the rats is low. So, you know what is epizoonotic diseases? So, epidemic in zoonosis mean animals. Epizoonosis means epidemic in animals. Epidemic means outbreak, so sudden increase in cases, and zoonosis means diseases in animals. So here we are talking about the epizoonotic risk of plague. And so epizoonotic risk of plague is less if the index is less than 1, and unlikely to sustain or rapidly spread plague is less. Only routine monitoring is recommended if the index is less than 1. But what it will tell if the index is more than or equal to 1? So it will tell elevated risk of epizoonotic. That means so there will be chance of plague outbreak in the rodents. If an index reaches more than or equal to 1, act immediately to prevent epizoonotics and human plague. So, when we are seeing epizoonotic in rats, that means outbreak of plague in rats we have seen. So, because of this plague, these rats will die en masse. En masse means many rats will die. So, after rats' death, these fleas will fly freely, and they will suck blood from humans or other animals. And when these fleas are biting humans, then they will inject the plague bacilli into humans. We will get plague. So how is the host to transfer mechanism is occurring? Means if rodent dies, these fleas will be hungry. So hungry fleas who lost their host, they will actively seek humans to bite. So which will transmit plague. And now we will see what are the diseases spread by this fleas, and what is the mode of transmission, and what is the blocked flea. So diseases means because of Xenopsella cheopis, plague will be transmitted. So the bacilli here is Yersinia pestis, and other diseases like epidemic or murine typhus and chiggerosis and tapeworm infection, also Hymenolipis diminuta. So this is diseases, and how it will transmit. These fleas will transmit by the mechanisms of biting. So to when they are sucking blood, so then this bacilli which are there in the fleas will be injected into the humans or other mammals or birds. So biting is the main mechanism. After that, mechanical by proboscis transfer and feces. So when they are sucking blood, so this flea will flea feces which is deposited on the human skin, so that will also transmit the disease. And now we will see what is blocked flea. So when it is feeding blood on rodents, these fleas are feeding on rodents. So a healthy flea feeds on an infected rodent, ingesting Yersinia pestis bacilli. So when it is feeding on rodent, this plague bacilli will go into the body of flea. So after that, this plague bacilli will multiply rapidly in the proventriculus. And what will happen means because of rapid multiplication and abundance of Yersinia pestis bacilli in the body, it will block the flea food passage. Then it cannot suck the blood properly. So the flea will be in very much hunger. So what will happen means when it is unable to feed, the starving flea bites repeatedly and aggressively because the passage is blocked, and it cannot swallow, and it will regurgitate the infected blood mass, and it will inject the plague bacilli directly into the humans when it is biting aggressively. So this is blocked flea. So blocked flea is nothing but its proventriculus. It will multiply in the proventriculus, and it will block the food passage of the fleas with multiplied plague bacilli. So this is nothing but blocked flea. And blocked fleas play major mechanical role in the rapid spread of bubonic plague. So because of this fleas, many diseases are spreading. So how can we control these vectors, flea vectors? So how can we control means like other vectors like mosquito and all, we can control by using insecticides like DDT and organophosphorus compounds like diazinon, malathion, carbaryl, and so other repellents will be there, vector repellents like DEET, diethyl toluamide, benzyl benzoate for personal protection, and these so like this we can control. And one more thing is, so if these rodents are low, then this rat flea population will be automatically decreased. So host eradication, nothing but rodent control. So this rodent control is an essential step strictly after flea control is established. Why? Because means if fleas are there like that only, and we want to eradicate rodents, then there will be no rodents and there will be many fleas. These fleas will be starving because of no rodents, and they will bite aggressively humans, which will lead to increased disease in again human population. That's why first vector control should be done. After that only host eradication, which is rodent control, should be done. So this is about fleas, flea indices, and blocked flea, and how to control these vectors. Thank you all.